Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Today is Sunday, March 15th. It's 4 p.m. Just recorded a quick update from Dr. Gus Vickery in Asheville. They have a pretty cool project down there where Dr. Vickery has helped arrange drive-through testing. So we're going to play that audio right now. And when we come back, we're going to talk specifically about treatment updates, testing updates, and just what's happened today. Dr. Vickery, thanks for joining me on such short notice. I know you're super busy. For those of you who don't know, Dr. Gus Vickery, I'm talking to right now. Dr. Vickery is a family medicine physician in Asheville, North Carolina. He's a part of the Wild Health team, a friend of ours, and he's leading some really cool initiatives there in Asheville because I just finished talking with an ICU physician in New York City, and I think it's really good to get perspectives from different places just so we can all see what each other are doing and potentially replicate the things that are working. I understand that you all have set up drive-through testing there in Asheville. Can you tell me about that?
Yeah, we've been able to coordinate with a lot of community partners and make this happen. Our local health department has been trying hard to catch up regarding how we're going to appropriately identify suspected cases and begin to quarantine individuals. So as you know, as we discussed in your last podcast, how we can flatten this curve and save lives. And we were able, with our urgent care team, we've already been in the past week identifying the right process to be able to evaluate and test suspected cases. And it's a bit laborious. There's a lot of triage questions, and then you have to go through a process of course, assessing them for flu and then testing them for COVID. And once you do that, if you did have enough suspicion to test them, then there's also a pretty lengthy self-quarantine contract that they're signing, agreeing that they will not re-enter the community until their test returns negative, if it does in fact turn negative. But we've been working on that through the past week because there's really been a lack of clarity of best processes. And of course, one of the most important is how you keep your team safe while you do this. So we were able to identify that we could set up a drive-through site. The pharmacy urgent care that we operate is in a large strip mall-like setting, so there's a big parking lot. We have a partnership with the Biltmore Company, and they were kind enough to send their crew over and put up a 40 by 60 tent. So we have adequate protection from the weather, traffic cones, et cetera, so that we can have 2 lanes for cars. We were able to get a full protective suit from the compounding pharmacy that we partner with because they have a clean room. So our nurse practitioner who's going to actually do the patient evaluations is able to be fully protective with the appropriate PPE, which is important. And we're also going to be able to help people use their insurance for this process. So we've got a team together, and we're going to be able to have people stay in their car so we can reduce exposures. We'll be able to give them a set of paperwork to fill out, and we'll be doing some triage. And of course, if they don't have current symptoms, given the lack of testing kits, which, as you know, is one of the greatest rate limiting steps we have right now, is the actual availability of kits. We were able to put together 76 kits at this time via what we'd received and what some community partner offices have received who did not feel they were equipped to have a process for assessing this virus. So they were more than happy to pass those our way so we could kind of take over, at least lead the way for now with this process. So we have, of course, the flu test, the actual viral testing kits for coronavirus. And then will work through the triage process, identify those who we think need to be assessed. We'll be able to, while they stay in their car, do a pulse ox, pulse rate, temperature, possible auscultation of the chest if we feel like it's important, identify individuals who may already need higher level care, triage them. For those who don't, we'll be able to do a flu test. If it's positive, stop there. If it's negative, then we'll move to COVID testing and helping them understand what that means for them. So, yep, that's basically what we're going to be able to do today. And we were able to get the health department and other community partners on board. So the police, the Asheville Police Department is going to station an officer there in case it gets really busy so we can help with traffic control, et cetera. So it's our first stab at it. Our health department doesn't feel like they'll be equipped to offer this type of testing for at least another week at the soonest. And our local hospital really hasn't gotten set up to do it yet. So it's a opportunity for us to help our community get ahead of this at this time. Well, yeah, as you know, we can't really get ahead of it. We're already behind it, but at least get ahead of being behind.
So that's why I wanted to talk to you. You have a 7,000 patient practice there in Asheville, serving the community, and you've been able to organize and really kind of potentially get ahead of some of the kind of formal organizations. And so I wanted to hear about this process and how you got that done. How also are you dealing with such a large volume of patients being worried and scared? How are you communicating with them and trying to utilize telemedicine? Because for our patients, for example, we're asking them to tune into the podcast. We're updating twice a day, and they can kind of stay up to date that way. How are you communicating with your patients? For other family practice doctors out there who are trying to navigate this space and figure out how to be most efficient and help the most number of people?
Yeah, we have started just like you have, going ahead and communicating. We've been sending short video updates to our patients about twice a week. We're going to move that now to daily, where we tell them our current understanding of the situation, what the best process is if they are concerned for themselves, and of course also offering them help about what they could do to protect themselves and improve their immune systems, etc. We will be providing now those on a daily basis to our clients, to the people that we serve. With what's happened today, our ability to coordinate the launch of this drive-through site, we've been in touch with a number of other primary care practices in town, and what we hear from them is they don't feel equipped at this point in time to protect their staff and to manage this. They don't have the proper PPE, as you know, is a real problem right now for healthcare providers. So I think a lot of people are relieved that we're able to maybe provide an avenue that will minimize exposure to healthcare workers, minimize exposures of these individuals who need to be tested to other people, and begin to identify cases that clearly need quarantine and quarantine those that are highly suspicious until we can get clear testing results. So I think that there's a sense, I mean, we know that this is going to change daily. I mean, we were literally changing our protocols every half day last week based on what we were receiving from the health department, the latest updates. And so we know that the process we work today will help us today, help our community today, but we don't know it'll be the same process we use tomorrow morning to do the same thing again. But the main thing is that we want to keep sending these updates to our own patients so that they understand the importance, and especially right now, as you know, the importance of the social distancing. I mean, right now, so many people are still just very blasé about this. They think that we're over-responding, overly concerned. And, you know, as you've stated on, I think, some of your other podcasts you've been on, we're not as concerned about ourselves individually. This is about saving lives in our community. And we know that this response now and everybody doing the right thing is going to save lives. And so it's just really important that people take this so seriously and begin to stay home and wash their hands and cancel those larger events and all basically, don't allow some flexibility on our personal agendas to serve the better social good right now.
Gotcha. You this was just organized a few hours ago, and you texted me about it and sent me a link. And you are starting to test in about an hour from now. So
yes.
We're going to release this podcast. This audio will come out today on Sunday. I'm also going to put on our Instagram a link to the article about it, so anyone in Asheville who wants to get testing, and you're going to learn a lot. So what I would like to ask of you, I'm actually going to be in Asheville visiting you in about 5 days on Friday. So I'd love to just do a quick interview with you then, just to talk about what you learned so that other communities can set this up as well, because I think it's a really cool thing that you're doing.
Yeah, it's great, and we'll be happy to once as we get this process down and see that it's working. Would love to share that formula with other people. We think it's going to be really important that we're all set up to do this. Oh, and the last thing you asked me about telemedicine, absolutely, we're going this week. We're moving all non-needed face-to-face encounters to telemedicine. We're encouraging our patients to stay home and let us work with them that way. So yes, now is the time for that. I know I'm preaching to the choir on it.
Perfect. And if you have those protocols worked out before Friday when we talk again, send them to me and we'll post them on wildhealth.com. We have a wildhealth.com/COVID, just kind of continual updates. So if you have that, share it, and anyone that wants to use it, we'll have a nice protocol there for you about what's working.
I certainly will, and I'll post it on that community Google Doc you've sent out earlier as well.
Great. Thanks so much, Gus.
Thank you, Matt. Stay safe.
You too.
All right. So let's see what has happened today. I recently saw a pretty interesting article, Matt, that was looking at sort of predictors of progression to severe disease. So this is coming out of some of the early data in China. So this is specific to some early Chinese patients. I believe it was about 120 patients in the sample size, if I remember correctly. And they were finding odds ratios ranging anywhere from 6 to 12 for age over 60, smoker, presenting fever of greater than 37.3 Celsius, low albumin, less than 40, and a CRP of greater than 8.2. So some interesting things that could potentially suggest who is going to progress and have more severe disease, and could be helpful if you're making presumptive diagnoses as well. I mean, if you're in this era where it's still hard to get tests, these things might be helpful. Knowing these things and who may require hospital admission, who may require more aggressive pulmonary support.
Yeah, that is interesting. I think it's interesting for physicians on the front lines. I want to try to talk today on this update about specifically to patients, though, kind of what you can do, because there's a lot that's happening. I just heard from a physician. We had our first. This hasn't been confirmed in the news, but our first death in Kentucky. It's kind of an imminent death of someone who's tested positive. So things are evolving really quickly on the ground here, like they are everywhere. If you're a patient, you're wondering about a few specific things like testing. That seems to be a really big issue right now with not enough tests. I was on the phone with patients last night. They were asking about whether they should get tested or not. And there's a shortage of tests, and you're exposing yourself if you do go in to get tested. So with testing, we're going to have a whole podcast tomorrow. What I will say is that from what I saw today, the best test I could look at, the CDC-approved test may be as low as like 68 to 75% sensitive. There's no great numbers, but we're going to talk to our PhD in infectious disease tomorrow specifically about testing. At Wild Health specifically, we have quite a few tests. It looks like we're going to have a pretty large number. I don't want to say the exact number, but we're going to have a large number of tests for our patients for now, and we're working on developing a test. But we'll give you a lot more information about that tomorrow. Any thoughts on testing, Mike, before we talk about some of the potential treatments that we've seen some evidence coming out for in the last couple of days?
No, I haven't heard anything specific regarding testing. I have heard that there are some shortages of nasal swabs. So while the test is becoming more available, there's been some difficulty getting nasal swabs in certain places. So that could lead to be another issue in the near future, unfortunately.
Yeah, and I think the testing is going to evolve. Right now, we're kind of rationing testing because there just aren't that many of them. But that's probably a bit of a problem because the people that are spreading this are the asymptomatic people walking around. So if we do evolve to a point where we have a lot of tests and we can test a lot more people, that's probably going to help decrease the spread. But that's an evolving situation. We'll give you a big testing update tomorrow. When it comes to treatment, there's a couple kind of hot things in the last few days I've gotten a ton of texts about today. The number one thing is chloroquine. Chloroquine is used as an anti-malarial drug. It seems to be really helpful when combined with zinc. It's a zinc ionoform transporter, so it helps zinc get into the cell and actually have an effect on the virus replication. This combined with zinc, I've been telling people, could be pretty important. We don't have good studies at all. We're not going to get randomized controlled trials for this, But right now, it looks like one of the more common drugs that may be very useful in the near future if we follow this data.
There's a study that came out close to 10 years ago looking at chloroquine's ability to inhibit replication of the SARS-1 virus, which is probably the closest relative we have to SARS-2, at least that we've got any good literature on. So there is definitely some indication that it could potentially help reduce the severity of illness, the viral replication. And it clearly does help zinc, when we know that well, that it helps zinc get into the cell, and zinc theoretically decreases replication of our RNA from the virus. So it makes physiologic sense. What we're hearing from the front lines, at least in a few reports that I've heard, is that it is improving patients with progressive pulmonary symptoms. So we may see some new literature coming out about chloroquine in the very near future.
Yeah, there are some specific studies out of Wuhan and Korea with their experience, because the question is, well, how much and when? You want the details for this actually being effective. So from Wuhan, in one study they did 500 milligrams BID. In the Korean study, they did 500 milligrams daily, and there seemed to be better outcomes in the Korean study. That doesn't mean that once a day is better than twice a day. You're probably going to tolerate it better once daily. So if we don't have any evidence that twice a day is better, I would say once a day probably is better. And this is a complete guess, because those obviously are not head-to-head trials. They're two completely different things. But right now, my thinking is once a day, 500 milligrams, if someone had this. But again, this is not an FDA-approved treatment. We're not saying to take this. We're just trying to share information as we get it. I have actually heard of some medical providers on the front line and ERs or ICUs that they know they're being exposed, taking this prophylactically, and the prophylactic dose they're taking is once a week with the zinc as well. There's no evidence that this is going to help, but some people are thinking about it.
Yes, I don't know. And without any evidence, I have trouble with the idea of taking this prophylactically. I mean, we don't know that it's going to prevent infection. And if, there's a limited amount of chloroquine in the world, I mean, for the most part, it's only really used for malaria and autoimmune diseases. So it's not exactly like it's not like there's a ton of it sitting around waiting to get used for something. So we run the possibility of, if 25% of the world's population gets infected and then 20% have severe illness, we could very easily run out of this drug. So I guess I would at least bring up the ethical question of, should you actually be taking this prophylactically?
Yeah, and it's a good question to ask, Mike, but people do take it prophylactically for malaria, and this hopefully is a drug that can be spun up very quickly and rapidly in large doses. I don't know if that's the fact or not, if that is the case, that it can be, but hopefully it can be. Hopefully people are working on that, and hopefully people are studying this, whether it's going to be efficacious for prophylaxis and treatment. The studies are really suggestive and really interesting at this time. It's one we're going to keep watching. Having said that, we've had a few things that looked really good or we thought made sense physiologically, and they didn't really work out, just like ARBs. That's an example of one that it kind of made sense physiologically, and then it turned out that it actually may make things worse. This is a situation where we need to kind of act quick and good evidence, but you got to be careful about acting too quickly in these situations.
Yeah, ACEs and ARBs are interesting because they've been shown to sort of decrease the inflammatory response in the lungs, basically, and that has theoretically been advantageous with influenza-like illnesses in the past, where especially if you have like a younger age group who's got a stronger immune response. But coronavirus is a little different in the sense that we've got a older age group who seems to be most at risk. So it's probably a lack of immune response rather than turning down the immune response that's going to be advantageous, And
just to be clear, an ARB is an angiotensin receptor blocker. It's a drug for hypertension or high blood pressure. So it's something that a lot of people are already on. So we wouldn't say that you need to start this for prophylaxis or for treatment. We also wouldn't say that you need to stop it. The evidence is not clear, so we're just watching this. The one antiviral that it does seem is probably one of the most promising is remdesivir. The problem with this is that's useless information to you because that's not commercially available. You have to get that directly through Gilead, the manufacturer, in order to be able to use it.
Right, and there are a couple of studies going on. Obviously, those are going to be limited to patients who are critically ill in the hospital. And as far as I know, access to this medication is also extremely restricted at this point, and there's very little of it to go around.
So, in conclusion today, they're not a lot of updates for you. We're going to continue watching the chloroquine and all the other medications. I've heard from a few people today who still aren't that worried. I think some people aren't understanding the math on this. The real problem, I think we've stated before, but just to be clear, is the strain on the system. I heard a really interesting podcast today where someone was talking about the math in New York City, and with the current numbers, how things are trending, they felt like the ICU beds will probably be completely full within 2 to 3 weeks based on the current daily multiplier that's out there. That could be completely off, and things are going to change every day based on what we do. But that's the issue. So I talked to a patient yesterday. I just want to bring this up because I think it was an important point. 2 different patients. One I was talking to that said, I should be fine, right? I'm young and healthy. This person was pregnant, and I said, you probably will be, but when are you delivering? It's 2 months from now. Do you really want to be delivering in a hospital where there are 3 times more people than there are beds for them? Routine things become non-routine. And I had another patient who was 40 who asked me the same thing, said, I'm totally fine, right? And I said, probably. But again, the chances of a negative outcome go up exponentially. And I'm only saying these things because we want to continue just stressing prevention is the number one thing that you can do for yourself and for everyone else at this point. And that's the reason, too, that we're thinking and talking about some of these treatments like chloroquine. If it's something that could be given to mild or moderate patients to keep them home and out of the hospital, then it could be really promising. So we're going to continue watching and thinking about it, and we'll give you our thoughts as we get more data on it. Tomorrow morning at 7 a.m., there's also going to be a podcast release with Dr. Scott Weingart on if you are a medical provider. This was more geared towards patients, but tomorrow, tune in. Dr. Weingart is going to talk about how to protect yourself as a medical provider.
All right. Thanks, Matt.
Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can